All right, now we're going to work on nasal bone decompression, okay? As we go through the cranial suture series, typically, it depends on the person, but let's categorize a couple different people. So you have people that have jaw pain that specifically need temporal bone to be mobilized, which oftentimes require some of the other cranial bones to be mobilized in order to best access that, okay? We have people that have headaches or neural tension, that the end goal is let's get sphenoid mobilized better, okay, because of the dural attachment on sphenoid. And in that case, you also have to work through a lot of the other cranial sutures in order to get to sphenoid, because it's kind of like one of the deepest ones, all right? Some people believe we can affect sinus pressure, okay? So if we can affect sinus pressure in some way, or even if there's a hard infill on the nasal bone, maybe we need to work the nasal bone to reduce the sinus pressure. That would be like the most obvious thing, but also there could be a component of the nasal bone not allowing sphenoid to move as well, or distantly it could be related to temporal bone not moving as well. Okay, so this is getting a little like frou-frou-y, and you're gonna kind of have to play with what works for you as a therapist. But kind of what I tell my clients is I just kind of make a joke of, there are people that believe that the cranial bones don't move and don't have any kind of functional purpose to work on. But if people are getting better, then that's a reason to at least check it out. And so you may or may not ever use this, but I use it and have specifically helped people with this. So that was a longer spiel than I wanted to go into for nasal bone, but here we are.